Good afternoon, everybody. Welcome to this Social Work England session. It's all part of Social Work Week. We're on day three of our week of events. We have other events taking place, so do feel free to book onto those through our website. Details can be found through the address on this slide. Really looking forward to this session that we're about to put on. It is just so we're all clear. It's the session. Who am I? That's the great puzzle. What is social work in child and adolescent mental health? Before I put on our speakers, I'll just talk us through these next couple of slides. And first of all, just to say, from a legal point of view, that the views and information expressed by third parties don't necessarily represent a position from Social Work England. And if I now just point you towards privacy, obviously we have information, your information, but we're not going to use that for any other reason from the one that you've given us permission to do so. And there's a link here which will take you to the details of how we'll use your information.
Thanks, Gavin. Welcome everybody to this session all about CAMHS. I'm just going to take control of the slide. There we go. Thank you, Social Work England, for having us here today. We're really excited to come and talk to you about the Child and Adolescent Mental Health Service and what it's like to be a social worker there. I hope everybody's managed to have some lunch or is perhaps having some lunch while we're talking. My name is Annabel Smith, and I work in the Child and Adolescent Mental Health Service in Hertfordshire. I work for Hearts Partnership University NHS Foundation Trust. I just want to check if everybody can see that first slide, because I haven't got anything come up. Gavin, can you see it?
So I will be honest with you, it does actually not look how I would expect it to look, but we had it briefly there.
There we go. It's there. Thank you. Hopefully there won't be any more glitches. So here's my introduction, and the title of today's session is Who in the World Am I? That's the great puzzle taken from Alice in Wonderland. So I'm Annabel Smith. I am the professional lead for social care in CAMHS in Hertfordshire, like I said. Basically, that title means that I'm the lead social worker across all of our child and adolescent mental health services in Hertfordshire, which is we have community teams, we have an inpatient team, eating disorders, mental health in schools teams, amongst others. And I lead on behalf of all the social workers in our services. And I'm also part of the senior leadership team, working really on strategy and operational aspects of the service in conjunction with our colleagues in social care. I'm really happy to be joined today by some of my fellow team members from CAMHS in Hertfordshire. So I'm just going to let them introduce themselves as well. They're going to be providing a little bit of a sort of panel. So as I talk through the slides, I'm going to keep handing over to them for their views and thoughts as well on the information that I'm sharing, just to give you a bit more sort of interest and a bit of a rest from hearing me talking non-stop. So I'll just pass over to them to introduce themselves. I'll come to Natalie first.
Hi, my name is Natalie Angel, and I'm a consultant clinical social worker in the CAMHS community team.
Thanks, Natalie. And Serena?
Hi, I'm Serena Baker. I'm the senior clinical social worker in the CAMHS crisis team.
Thanks. And Ellie?
Hi, I'm Ellie. I'm a newly qualified social worker, also in a community CAMHS team.
Thank you. And last but not least, George.
Hi, I'm George Bothick. I am a social work student on my final placement in CAMHS.
Fantastic. Thanks, everybody. And just before we really sort of kick off, I just want to kind of make a bit of an acknowledgement from the beginning that I have linked, as you can see from the title, some of what I'm talking to the very well-known book Alice in Wonderland. And I just wanted to acknowledge that that's kind of really a white female aspect throughout that story. The reason that I've chosen Alice in Wonderland really is because the concepts of travelling through an unfamiliar land and trying to understand identity just felt really, I could really relate to it. So I just wanted to acknowledge that in the room before we started. Okay, so in this first slide, the intention was to show you a little clip from Alice in Wonderland, but I think copyright issues, I can't do that. So I've got just a little quote here to sort of start us off. Alice in Wonderland, she says this quote, "Dear, dear, how queer everything is today. And yesterday, things went on just as usual. I wonder if I've changed in the night. Let me think, was I the same when I got up this morning? I almost think I can remember feeling a little different. But if I'm not the same, then the next question is, who in the world am I? Ah, that's the great puzzle." Alice asks this question of herself in Alice's Adventures in Wonderland when attempting to determine what composes her identity in a land that's unfamiliar and confronts her sense of self. As she is plunged into a world in which none of her beliefs make sense, against a system of total nonsense, she feels her own sense of self begin to come unmoored. When I read this, I could really relate to this from my experience of coming into CAMHS, which I have to admit was quite some time now. It was about nearly 20 years ago. And I came from the local authority into the NHS, into CAMHS. And the experience did feel very much like falling down a rabbit hole. I don't think I really appreciated quite how different it would feel. I thought it would be very similar work. But I did feel quite out of my depth and in a foreign land. You kind of land into a clinic setting with a lot of medical terminology and language and processes. I felt quite alone. I wasn't really sure quite what I was supposed to be doing. And I sort of really resonated with the bit in Alice in Wonderland where she drinks the potion and she shrinks. And I could feel myself shrinking and sort of losing the sense I had of the skills I had and quite what it was that I was going to be bringing as a social worker. And then the bit where she eats something and she grows, again, I could really relate to that sense of feeling like I didn't really fit. I didn't fit the space and not being sure about what to do about that. And as a result, I was really questioning myself. Like, had I changed as a professional? Was I still a social worker? And if I wasn't a social worker, then what was I really? So I want to come over to the panel at that point, just to kind of say to them, why CAMHS and what was that like for you when you joined us? So I'm going to let them just kind of come in as they like.
I think I wanted to kind of say, because I came into CAMHS quite recently, only 2 years ago, from doing local authority child protection work for a very long time. And, you know, your experiences really resonated with me. And I think one of the things that I found really hopeful about coming into CAMHS was this idea that I could do some therapeutic work and that I have some space to work with people and spend more time building those relationships, getting to know them and kind of working them through a journey. But the idea that that was somehow different from what I was doing before, or I would have more time or more space, is just kind of where I came from, and kind of there was a loss there as well for me about, well, I was working therapeutically before. How is this different? What am I doing differently? You know, I'm not a therapist. Am I a therapist? So, but the idea around CAMHS and the mental health aspect and seeing that process through.
Thanks, Natalie. There's that kind of that question of therapeutic and therapy. You know, you can work therapeutically without being a therapist, and I suppose the argument that social work, you work therapeutically all the time. Thank you. Anyone else got any thoughts they want to share?
I think similarly, I think it was that, I mean, as a social worker, you always want to make a difference. But I think for me, working, again, I experienced in local authority and then the NSPCC and lots of different things. But I think it's wanting to help that individual young person try and make sense of some of the stuff they've been through. Because as social workers, you have to do the whole, in, you know, local authority work, you do the whole bigger picture thing as well. And I think, I mean, to be honest, we still do that within CAMHS as well, but having that opportunity to work individually quite intensively and hopefully helping the young person make sense of some of the stuff they've been through and giving them tools and skills to perhaps move forward in a more hopeful way with, like, you know, positive coping strategies and to make sense of what's gone on for them. I think that was one of the motivators for me to come into CAMHS.
Thanks, Serena. Ellie and George, is there anything that you'd like to add in?
Yeah, I think for myself, obviously, my first qualified post was in CAMHS, and I can remember finishing my final placement in a statutory frontline team and just feeling quite deflated, the sense of I've just done all this training, I'm really passionate about what I've learned, but I didn't feel like I fitted there. And I actually didn't know that there were options really outside. Obviously, we're told social work is so broad, but then when you get to the point of applying for jobs, it can feel like, well, there's the local authority or what else. And it was only when I kind of was in that, I guess, that rabbit hole of searching for jobs that CAMHS appeared. And suddenly it was like, oh, I've discovered this whole world of social work, which I didn't even know existed. I was never told about at university. And actually coming in as a newly qualified social worker has enabled me to, I guess, all the things that Serena and Natalie have shared, work therapeutically and grow as a social worker in a space that 12 months ago I didn't even know existed. So it's a really creative and exciting space to be in now.
Thanks, Ellie. And no pressure, George, but if you wanted to say something, you can.
Yeah, so obviously I've only been on placement since January, and I do especially resonate with when you eat, you grow. For me, it's in CAMHS, there's so many different teams and so many different experiences that you can kind of pick from. So coming into this, obviously not knowing a lot, it's my first statutory placement. CAMHS, the way it's set up as well, you feel like you're getting a little bit of knowledge every day and you're building yourself up. So I came in not knowing what CAMHS was, what the role of a social worker was in CAMHS. I knew I wanted to go into mental health, but every day is kind of a new experience. I'm learning from loads of different professionals, and yeah, each day is new and exciting.
Fantastic. Thank you all so much. So I thought I would just begin a little bit with a quick history of CAMHS. As you can see from some of what the panel have said, a lot of sometimes people aren't even aware that social workers can work in CAMHS. So just to go back over where CAMHS came from, I thought might be helpful. So in 1928, the Child Guidance Council was set up to encourage the provision of skilled treatment of children showing behaviour disturbances and early symptoms of disorder. This was the result of pressure from education and health officials who were concerned about the abilities and behavioural problems of children brought into the new statutory compulsory education system at the beginning of the 20th century. These developments were influenced by innovations in the USA, where the first child guidance clinic was established in 1909 in Chicago in a deprived neighbourhood. The interplay between social deprivation and children's emotional problems had begun to be correlated, highlighting the need for a social work dimension to assessment and intervention. Services at that time comprised of an MDT of health, education and social work. So there was a lead psychiatrist assisted by an educational psychologist and trained social workers. The social workers would find out the social circumstances of the family, diagnose the child and prescribe treatment. They were expected to offer individual psychotherapy, family counselling, parental guidance, conduct risk assessments and get involved with child abuse cases. So as we can see, social workers were a key component within this service from its conception. And like we've said, I don't think that's widely known or recognised. Just after the war, psychoanalytically trained childcare specialists arrived in the UK as refugees from Europe, and they were able to exert influence within the child guidance clinics in the UK. However, psychoanalysis was poorly understood by proponents of the medical model, and this caused the service to change in favour of evidence-based medicine and evidence-based education. This led in the 1990s to a public policy motivated formal takeover by the NHS, with the impact being an increase in the service employing practitioners who could offer evidence-based interventions, such as clinical psychologists. And alongside this, we saw a slow decrease in specific social work roles. Outside of CAMHS, and in addition to this, social workers who were outside of CAMHS saw their CAMHS counterpart social workers behaving like therapists. And this further isolated those CAMHS social workers from their fieldwork colleagues, who at that time were bombarded by high levels of demand. The focus on evidence-based practice came at a time when government policies emphasised and accelerated the growing culture of managerialism and the search for more cost-effectiveness. This combined to further erode the case for maintaining a strong social work presence in CAMHS, because largely it's difficult to get hold of that evidence to demonstrate the effectiveness of the practice. So over to the panel again. How do you feel when you hear about the history of social work in CAMHS?
I mean, I will say I didn't know any of this until you prepared this, Annabel. I think it's fascinating. I think the knowledge about where CAMHS started from, the history, is really significant to try and think about where we are today. It's really shifted. And I think this idea of social work being a huge value and really underpinning the entire foundation of what child and adolescent mental health services are makes so much sense. And it does sound like bit by bit it's been eroded in terms of kind of, you know, the impact that those other factors have that social workers are really skilled in thinking about and working with.
Yeah, thanks, Natalie. Anyone else?
Yeah, I think I was going to say the same. I think it really reinforces, doesn't it, the value of social workers in mental health, because I think we see that a lot now, certainly in our day-to-day working with other agencies. It's almost like we're giving a child to fix, like in isolation, like they've got mental health problems, fix them. And we're kind of going, yeah, but this child's living with domestic abuse, or this child has got all these unmet special educational needs that mean school is so stressful. And of course, that has an impact on a child's mental health and functioning. And so I think for me, it just really reinforces the importance of having social workers within the teams to kind of keep that bigger systemic perspective of all the factors that influence a child's functioning. And I'm also old enough to remember child guidance centres, which is slightly worrying.
Surely not right from the beginning, sorry.
No, obviously not that long ago, but they were still sort of there vaguely as I was.
Thank you. Anyone else? Shall I move on? Okay. So I became really interested in what research might tell us about CAMHS social workers. I have, as I said, I've worked in CAMHS for nearly the last 20 years. Obviously, I've had years of my own supervision. I've supervised a lot of social workers, qualified social workers, and I've also taken a lot of students through CAMHS. And invariably, this question comes up about what is the role? What do we do? How do we describe it? So I was really interested in looking at my own identity and to kind of think about the identity of my social work group as a whole. So as you can see from this picture of, it's Elmo, isn't it, I think, telling us there's not much literature there. There's not much to tell us anything. So I kind of then tried to widen out where I was looking for information. And I began really to look firstly at the generic social work identity, and then I looked a bit more at social work identity in MDTs, which is largely around adult mental health social workers, and then social work in CAMHS. So I just thought I'd do a little whistle-stop tour of that here. So this first slide, this is about the generic social work identity. And as you can see, as you look at that picture, you might initially think you recognise some things in there, but then the longer you look at it, the harder it gets to actually really pick anything out clearly and identify it. And that really spoke to me in with regards to this literature. There is quite a bit of research and thinking that's gone into social work identity, not just in the UK, but across the globe, really. It seems to be a bit of an issue. And the main thing that comes back is it's really hard to get hold of. It's really hard to grasp this concept of what is it that we do. So, and particularly in kind of mental health services, although social work has played a significant role, the knowledge base is very scanty in comparison to the other disciplines that work in mental health. And that leads also for the role and the contribution of it to be unclear. So let's have a little bit more of a look at that. There are views that the definitions of social work are complex, contested, and evolving. I mean, there have been efforts to try and establish clarity. BASWA and Social Work England have detailed the generic roles and tasks of social workers in England and the role of social workers in adult mental health. However, it does remain contended that social work is struggling to define itself and that social workers are trying to seek sureness and clarity and evidence of the effectiveness of their practice. The lack of this evidence base for social work intervention has been identified as a significant issue in being able to say what it is that social workers do and why, and what they do particularly well. So that's the generic part. In MDTs, and here we've got a lovely team here working together, look, giving each other a big high five. So in MDTs, particularly in adult mental health, research has shown that social workers have appropriate skills for MDTs. It's really positive. In a UK qualitative study of social work in MDTs, it was argued that social work's well positioned, both as a negotiator both between professionals, so professionals from one service to another, but also between professionals and families, and that social workers can and do work well in MDT settings. Sometimes the language that I've come across in describing this role is sort of being like a translator or being a mediator between various different groups of people. However, several studies have found that MDT working can create stress for social workers, with the issue of role conflict as being found to cause stress and to lower job satisfaction. There's something around the position and the role that they take within the team as a social worker that can cause stress. In one study, the detailed evidence of social workers' unique contribution to adult mental health teams was that the role was expressed in terms of both what they do, which was enabling service users' recovery and social inclusion, and how they do it, by prioritising the relational element of their work. Findings also indicated social workers as important in supporting colleagues and enhancing the whole team, which is a really interesting role that social workers are bringing. The social workers themselves described themselves as being more tolerant of chaos and uncertainty than their team colleagues, which enabled them to dispel crises. And this was expressed as an ability to sit with crises and reflect on challenges with the aim of finding alternatives. In another study, many social worker respondents in adult mental health teams identified that other medical professionals lacked respect for them, leading to feelings of dissatisfaction, understandably. While working in medical settings, social workers reported having to continually justify their social work role, knowledge and skills against that of specialist roles. And to me, this sounded really disappointing, but also even more disappointing, sounded really familiar. And this is a lot of what I hear anecdotally being raised to me by social workers in CAMHS. So what about the literature on social work in CAMHS then? And this is a picture of one of our CAMHS rooms with a family in it that's available on our website. So I'm not just gone in and taken a picture of them. They're happy to be there. So really, in a nutshell, there's very limited literature on the specific role of social workers in CAMHS. It seems to be a really unknown part of what social workers do. For example, like there's little bits and bobs. So as part of a chapter on the history of social work in Ireland, an author describes the task of a social worker in a child guidance team in the 1970s and describes this as providing a holistic assessment of mental health, including an awareness of the individual child, their family, community and wider environment, and the interventions including casework and group work. In wider reading, sort of more anecdotal reading, there seems to be an acceptance. There's a value to having social workers in specialist CAMHS, but this isn't from any research. Other authors have commented that there are limits within the medical model in child and family mental health. And alongside this, the value of social work has been described as having an alternative viewpoint to the prevailing medical model, and that the presence of a social worker in the MDT may provide a balance. One writer argues that social workers are in a good position to lead preventative work, and we're seeing a lot more coming online now in terms of the earlier preventative work in children and adolescent mental health, in terms of our mental health in schools teams and primary care teams. Interestingly, in the USA, clinical social work, the term clinical social work, was introduced in 1968 by practitioners who felt alienated from their social work colleagues, and they therefore formed a professional organisation. In the USA, clinical social workers have taken the positions formerly held by psychiatrists and psychologists in clinical practice, and they've actually become the country's largest supplier of mental health services. Internationally, there's been a growth in clinical social work, and this has been rolled out across countries in Europe, but not in the UK. So I looked at some studies in Europe. I found one. It was a small biographical study in Greece of 3 clinical CAMHS social workers. And this piece of research indicated that the practitioners felt their professional identity, skills, and interests were different from those proposed by their current social work education and practice system. The study found they appeared to retain their nuclear social work identity, but also felt they belonged to a specialism which was not supported by their professional network. To me, this sort of suggested a feeling of alienation from their core profession. But he then goes on, the researcher, to find out that these social workers also identified antagonism from other mental health professionals related to the appropriateness of them offering therapy. And this to me also suggested an alienation from within the service. So they were feeling a bit distanced from their professional body, but they were also feeling a little bit distanced from the service in which they worked. I mean, obviously, this was a really small study. It was biographic, so there was only a sample size of 3. So you can't kind of necessarily make claims across all of these services with this. However, the researcher argues that the issues faced by his participants also relate to a wider international debate concerning the mission and professional identity of social work. Another qualitative research study in Ireland found that there's not one universally understood specific CAMHS social work role, that the development of a role is led by factors both external and internal to specific teams, the further training undertaken by social workers, and the particular skills and interests of the individual social workers and other team members. The findings from that research suggested that social workers viewed their particular contribution to CAMHS as offering a social perspective to complement the medical understanding of mental health issues in childhood and adolescence. Social workers saw themselves as becoming involved with the more complex and difficult presentations, which kind of mirrors what was said in the adult mental health research, where social workers were talking about managing the chaos and uncertainty. For me, both studies point to the need for further research in role definition in CAMHS and to the need for further development of the professionalisation of CAMHS social workers. From an extensive literature review, there's clearly a gap in understanding what it's like to be a social worker in CAMHS, and therefore a lack of knowledge about how to support and develop these roles. And this is kind of there when I stepped in and thought, okay, well, I'll do some research, but I'll come on to that in a minute. Just to come over to the panel, what do you feel when you hear about the current research into the role you work in?
I find it is quite fascinating, actually, to be in a very medicalised team where the language is evidence-based, what's the current research, what do we know, and then to know that actually I'm working in a role where actually there isn't a lot of research into it, there isn't a grounding, but we know that actually outcomes for families who work with social workers in CAMHS, like on the ground, seem to create positive change. So it's that trying to, I guess, knowing that actually our role is valued and offers so much, but what is that big gap of research that I'd like to think would highlight and show, the positive impact social workers have, and also align us with all of the other professions that have this whole wealth of research that proves why it's evidence-based, even though sometimes on the ground the evidence-based work doesn't always feel so like it's creating the outcome that it should as this magic evidence-based solution. So I think it's frustrating to know there isn't that research, but exciting at the prospect of our roles being researched and understood more widely.
Thanks, Ellie. Anyone else?
I think what I'm really interested as well, Annabel, and when you were talking about the idea around the alienation from both kind of groups in that study that you'd found from Greece. And I think what's really interesting as well, because you talked about the containment in the MDT in a previous slide about how actually the other professionals working in MDT feel contained by the social worker role. And I really see that contradiction in practice on a daily basis. I don't think it's a random thing. I don't think it's an unusual thing. I see this idea that in one moment in an MDT discussion, we're talking about, well, what's the evidence base and who's the most appropriate person to work with this family? And on the other hand, people seek out those social workers in the team to offer advice and guidance and support and from professional capacity cases, families that we work with, but also in the systems that we work with as well. So I think that's a really interesting and this comfort, I think, in the social work skill base to sit with the contradiction and to be okay, like you were saying, in terms of the chaos. And I really do see that in everyday practice.
Thanks, Natalie. Yeah, that's really interesting. And also, I think there's an odd sort of juxtaposition with the fact that in the research in adult mental health teams, they were talking about other professionals perhaps not valuing them in the same way, but then on the other hand, the social workers holding the most high risk complex cases. So there's obviously quite a lot of faith that's put in the social worker that they're holding all of that complexity, but at the same time kind of going, why are you here? What do you do? So yeah, a really interesting thing. Anybody else?
I was just going to say, following on from Natalie, talking about the MDTs and kind of how other professionals view social workers, the MDTs that I've seen or been a part of, I have noticed that they tend to rely on social workers, especially around safeguarding. So they'll happily talk amongst themselves in certain aspects, but then as soon as there's a question of safeguarding, the question immediately directs to the social worker. So I think they view the role as, oh, it's just around safeguarding. That's what they're trained in. So it is unusual at that kind of level as well.
Yes, thanks, George. Okay, guys, shall I move on?
I just wanted to add one very quick point, Annabel. I am curious about then who would take up the idea of further research in this, because I think it would be really beneficial.
Well, yes. Are you putting yourself forward? Okay, I shall move on. So done all of this literature review, and it's sort of led me into thinking I'm going to research some of this myself. So I'm coming towards the end of a doctorate in social care now, professional doctorate. And my research question in general is, what is it like to be a social worker in CAMHS? And I'm using a narrative approach. So again, it's quite a small sample size. I've had 8 participants, but done very, very in-depth narrative interviews with them. So I've got a wealth of data from CAMHS social workers in England. So I just thought what I would do here, I'm sort of midway of doing my analysis, but there are some key themes that are coming out which sort of really reflect on what we've already said so far. So I just thought I would share these with you. So bear in mind, these are really sort of high level themes. This isn't probably going to be what it's going to look like at the end, but these are just my sort of initial thoughts. So the first one is a little picture there of, that's my dog, the little black face at the window there, and his brother and my brother's other dog there. So they're all stuck outside, as you can see, and they're looking through the door at me. And I chose this picture because one of the themes that's coming up is about somehow CAMHS being impenetrable to social work. It's difficult to get in, it's exclusive, it's often hear this term like ivory tower, or it's elite. And how do I even get started in there? And one of the things that seems to have helped some of the participants that I've worked with is somebody's sort of directed them or given them some links into CAMHS. And so like my little dogs there, they need me to open the door and let them in. They can't do it themselves. There's somehow that sense that somebody can't just kind of approach CAMHS by themselves and get in. Panel, any thoughts from you on that one, about that sort of outside looking in?
All I can talk about really is from a university point of view. I didn't know that social workers were in CAMHS. I knew there were social workers within mental health. So the only way that I've found a way in is through a placement, which I didn't necessarily choose myself. So there is kind of at a university level, there's not really that conversation happening of, oh, you could look at children's mental health. I knew that adults was a possibility, but CAMHS itself, I didn't know there was a specific social work role.
Yeah, thanks, George. The second picture I've got, the second sort of theme that's coming up here, you can see a cheetah lined up to start a race and kind of saying, why do I keep having to prove for myself? Why do you know, we all know I'm the fastest animal. Why do I keep having to do this? And this has really come up in the research, a sense of having to justify why you're there. And we heard that in some of the adult mental health teams, of having to say why you should be there, people being questioned as to what is it you're bringing. And I don't think that other professions get that same level in terms of being in a CAMHS team. So yeah, there's a sense of having to prove yourself and almost as having to give yourself another layer of qualification. So it's not good enough just to be a social worker. You've got to be something else as well. You know, you've got to be, can't just be an animal. You've got to be the fastest animal. You've got to have a therapeutic qualification. And I suppose one of my, and this is my opinion, but one of my arguments is that I think the skills and experience and qualities that social workers bring, just as social workers, is enough, is brilliant. And also people have talked about at times almost trying to embody what another profession brings because they see that as being more valued. So they might try and kind of almost try and work as if they were a clinical psychologist or work as if they were a systemic therapist. And I know that I've often said to people, I think for the first 2 years when I came to CAMHS, I was trying to copy a clinical psychologist and bring that kind of role to the team, but they already had that. They probably didn't need that. Again, I'll come to the panel. Has anybody got a comment on that one?
Yeah, I was just thinking how it's also it trickles out even from just the team actually into the families that we work with. And because I've had a number of occasions where the family turn up for their first session and it's almost this disappointment and they go, oh, when will we get the therapist, or when do we get to see the person who's going to do this? And then as the social worker working with this family, it is that sense of I've got to prove to this family that I'm going to somehow magically make their child better, because if things don't change, then they were right. They needed the therapist, they needed the psychologist. But I think that comes down to actually just the narratives around what is the answer to fixing, if a better word, fixing mental health problems. And often social worker isn't people's go-to kind of thought of what they need.
Thanks, Ellie. The third one here, a bit of self-promotion there. That's me singing in my band. And this for me kind of related to the theme around the role being equally valued, I guess. So when I go out with my band, we all have the role that we take in that. And we all have moments where we might shine more than others, but we come together, and working together is what makes the sort of the whole. I know what I'm doing. I know what my role is there. I'm not going to suddenly sort of try and pick up a guitar and pretend to be the guitarist, and they're not going to start singing. You know, sometimes we might work together, so we might harmonize or something, but we've worked that through and we think about how we're going to do that. And for me, this is something about the social work identity in CAMHS is not being clear. There's no clarity or lack of clarity in what the role actually is. And then from that, therefore, a lack of us celebrating the different skills that we bring, and people feeling, again, valued for that. So that's where that's come from. Another theme, really, as you can see here, is a picture of lots of different signposts, not really giving any specific ideas or help, really. And this is a theme that people are bringing about, feeling quite lost at sea when they get into CAMHS. And there isn't an expectation that CAMHS services will have social work. So some do, some don't have any. Some have lots, some don't. Some have got some leadership, some have none. Some might have one social worker. So when you get into CAMHS, it's very difficult to know what your pathway is if you haven't got the leadership that other professions have. And then people kind of having to navigate their own career pathway. And people interestingly also talked quite a bit about, I've been here for so long, I don't know what else I could do now. So they also feel like they can't go into another aspect of social work, that they've kind of got, somehow they're in CAMHS and they haven't got anything else to offer. So this is a kind of really about pathways and leadership. And also I think there's something for the CAMHS services. They're not particularly used to social work. These are NHS settings. They're very used to nurses, they're very used to medics. They know how that works. They know if you've been a nurse for 5 years, kind of pretty much what you'll have been doing and where you've got to. But us as social workers, we can arrive in CAMHS at any part of our career and have done so many different things. It's very difficult for them to understand. So I think we need clearer pathways that we're driving to explain what it is that we bring and how we do it. The last one is another quote from Alice in Wonderland. This one's actually from the Tim Burton film. And we can see the Mad Hatter here saying, "You're not the same as you were before. You used to be much more muchier and you've lost your muchness." This is again really about being able to verbalize what we do, what we bring, how we do it, all of those kind of things, and a sense of feeling that you've lost something when you come into CAMHS, that you've lost some social work. Interestingly, we have a number of people employed in CAMHS services who might be employed as social workers with their title, but we also have a lot that are employed as mental health practitioners. So they may not even have that title still attached to their name. And I've had many conversations with people who've come into the service under those titles to say, no, you are still a social worker. You can still join our social work forum. You know, I'll still give you social work supervision. But yeah, the title kind of doesn't help, I guess. Just going to move on, guys. Is that okay? Okay. So just thought it'd be helpful to give some key facts about child mental health. So child mental health problems are common and increasing. Almost 1 in 5 children aged 7 to 17 now has a probable mental disorder. That is a 50% increase from 1 in 9 in 2017. The number of younger children reporting mental health difficulties and seeking support has increased. Childline reported a 29% increase in children aged 5 to 11 seeking support for their mental health, echoing reports from the Care Quality Commission that younger children have started to present with poor mental health over the last few years. There's also been an increase in significant mental illness and the number of children and young people experiencing mental health crises. This includes increases in emergency department attendance, hospital admissions due to mental ill health, suicide attempts, self-harm and eating disorders. Rates of self-harm remain high for young people, with almost a quarter of 17-year-olds self-harming each year. Suicide remains one of the leading causes of death for young people in the UK. On top of all of that, what we do know is childhood is the key time to intervene. 50% of lifetime mental health problems are established by the age of 14 and 75% by the age of 25. We are increasingly aware of the importance of good mental health in early childhood, and there are really worrying signs this is worsening. And on top of that, mental health problems are not evenly distributed across society, and they intersect with other forms of inequality and vulnerability. Children from low-income households, parental mental illness, LGBTQ+ children and young people, those with special educational needs or disabilities, looked after children, and those in the criminal justice system are all significantly more likely to experience poor mental health. We also know, don't we, that the wider societal, economic and environmental factors are negatively impacting the mental well-being of many children. A recent briefing by the Commission for the Equality in Mental Health gives an important reminder of how social determinants affect people's chance of experiencing mental health problems and their ability to move towards recovery. So it makes sense that social interventions should be a focus of energy in the community. Some more stats. Over half of young people aged 11 to 25 years old reported that the cost of living crisis was their major worry. Children are also impacted in terms of worrying about money. They're saying causing them stress, anxiety, unhappiness and anger. Social disruptions such as bullying or discrimination, and national and international conflicts are also impacting our children and young people's well-being. And eco-distress is also an emerging concept that refers to children's overwhelming or unmanageable feelings of anxiety when they hear about the environmental threats of climate change. Many of the factors that are key to helping people get well and stay well are social in nature. Here's a definition from Public Health England. A state of the definition of mental health and well-being is a state of well-being in which the individual realises his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. This definition reflects that mental health and well-being is not simply the absence of mental illness. It is influenced by an individual's experience and the circumstances they find themselves in, and the broader environment or society they live in. This can be summed up as a psychosocial understanding of mental health. Panel, does anybody want to come in there in terms of the presentations that we're seeing, or any of this about the kind of the social aspects of mental health?
Yeah, certainly. I mean, in my role with the crisis team, so a huge proportion of the young people we see, it's very rare that a young person presents in crisis with just a pure mental health condition. We do occasionally see young people that just coming in who are in psychosis. Sometimes it's been one-off, that sort of traumatic event, but usually it's very much in the context of family functioning, school issues, peer issues, and so very much, see the social work role as essential in that. It's quite, and having to negotiate with all the other agencies as well, because there is this real push that you're the mental health agency, fix it, and having to kind of go, but there's so much us contributing to this this child's presentation, which needs all of us to work together to kind of remedy it. So this is my day-to-day job, really, is doing all that.
Thanks, Serena. So why have social workers in CAMHS? Social work principles of empowerment, service user focused practice, combined with a social model of human growth and development, are valuable perspectives to bring to interagency work in mental health. Social workers in child and adolescent mental health services aim to work in partnership with service users and colleagues and professionals in other services to identify the needs, to facilitate emotional support and effective interventions for children and young people. As mentioned, the guiding principle is one of empowerment in the promotion and maintenance of the young people's positive mental health. The ability, The ability to work in and with the whole context or situation is an important distinguishing characteristic of social work. And there is an argument that social workers have a unique capacity to hold on to the external reality and the context of the whole family experience. That capacity to stay with the pain of each family's situation, to see patterns and sequences evolving, and to assess the impact of social policy and political changes on children and their families is important. The choice of intervention open to social workers in child mental health work is necessarily broad because of the wide variety of psychological and social factors influencing the children or young person being helped. We can draw on different theoretical resources in line with what is considered to be most useful to a particular person at a particular time, rather than being constrained by one model or approach. Sociological theories concerning the construction of childhood are a useful addition to the medical literature in CAMHS. Social workers use biopsychosocial approaches and recognise the service users' mental health and well-being are influenced not only by biological and psychological factors, but also by social and environmental factors such as poverty, discrimination, and lack of access to healthcare. Social workers are trained in delivering difficult messages, working with people who don't want to engage, going out into hostile environments, doing things quickly under stress, balancing people's rights in the legal picture. Social work as a profession has led the field in its emphasis on collaborative practice, the importance of consulting service users, and its commitment to anti-discriminatory practice and equal opportunities. So I'm just going to do a little bit of myth busting quite quickly. I'm looking at the time, so we're going to one sentence for each of these guys, please. So myths. We don't need social workers and CAMHS because we have social care. Anyone got anything they want to say to that?
I think we've already touched on it. We very much need us in CAMHS, because I think obviously coming against the medical model, and because we do see the bigger picture, we're very good at the whole networking thing. helping people know what the agencies are out there to support with the difficulties. Yeah, I'll be quiet now because I'm limited.
Thanks, Serena. A social worker's role in CAMHS is about safeguarding.
I just want to add to that, because I say in my team, it's everybody's, safeguarding is everybody's business. And so this idea, like George was saying, that, you know, kind of it's localized in social work is kind of this absolutely a myth.
Thanks, Natalie. Social workers must have lots of previous experience to come to CAMHS.
You definitely don't need your time on the front line to then break into some sort of speciality. You can come in, if your heart is for therapeutic and for CAMHS, then there's a route in, definitely.
Thanks, Ellie. CAMHS is impenetrable for social workers. I think you've just answered that one, haven't you, Ellie? Thank you. All children and young people with mental health difficulties need therapy.
I just want to touch on that because Serena has said this already. They almost never need therapy. It's almost always about the context, and it's very unusual to find a young person where it's just purely about them. Usually needs a family intervention.
Thanks, Natalie. Oh, social workers in CAMHS aren't real social workers. Too much talking, not enough doing. Have we heard that one before?
Yeah, I've got this to-do list that I can never get to, so I can vouchsafe that we do lots of doing, and yeah, it's not an easy option where you can sit around having lots of cups of coffee and, you know, lots of reflective practice as much as we like to.
Thank you. Okay, so I was going to play another clip here, just again from Alice in Wonderland. This is where Alice meets the caterpillar, but I've got the little conversation that they have where he says, "Who are you?" And she says, "Well, I hardly know. I've changed so many times since this morning, you see." And he says, "I do not see." She said, "Well, I'm afraid I can't explain myself, sir, because I'm not myself, you know." And he says, "I do not know." She said, "Well, I can't put it any more clearly, for it isn't clear to me." The caterpillar asks again, "Who are you?" And she says, "Well, don't you think you ought to tell me who you are first?" I've chosen this part of the film because we see Alice again being asked to explain herself and struggling to do so. And she talks about how many changes she's gone through and feeling confused. She rightly then asks the caterpillar who he is first. For me, this points to the need for leadership. We need leadership in CAMHS for social work in order to understand ourselves through that lens. We also need to be clear about what each profession is bringing to the CAMHS. We need role clarity. What are we bringing? And so we can understand the specific skill set that we're bringing. CAMHS is at a point of high demand and low capacity. It's vital that the service understands the roles and tasks for the staff it employs so as to maximise resources, efficiency and effectiveness, and to retain staff. And it is clear there is a gap in knowledge pertaining to social work. Interestingly, from the recent CAMHS benchmarking network, where we was looking at all of the CAMHS workforce, current figures suggest a growth in the number of social workers in CAMHS as a 51% growth. It's great. In the latest CAMHS workforce mapping in community settings, social work made up 4% of the workforce compared to 26% of nursing and 14% psychologists. So social workers are still therefore a much smaller professional group, but it's a growing group. And with the growth in number of social workers being employed, there's a pressing need to understand more about the role and experience. Also, in line with what we are seeing with our young people, if I take you back to the slides on the presentation of our young people, more people are arriving into our service with higher levels of complexity and higher levels of acuity. They're not ready to sit down and do therapy necessarily. There is a huge space for social work to grow in that area and to contribute. So I'm coming towards the end. Having been in CAMHS for nearly the last 20 years, I think I've mentioned that several times now, I wanted to share what I've learned. Probably be applied to other sectors for social workers too. I've adapted this not from an academic paper, but from a website about tea. And again, it links to Alice in Wonderland. So firstly, the importance of imagination. One of the most significant lessons we can learn from Alice in Wonderland is the importance of creativity and imagination. Throughout the story, her vivid imagination allows her to navigate the absurd and unpredictable world she finds herself in. Her ability to think creatively and come up with innovative solutions to help overcome problems and achieve her goals. As a social worker in CAMHS, the creativity and imagination we bring can be a powerful tool for problem solving and innovation. We allow ourselves to think outside the box and explore new ideas, which can open up a world of possibilities for our young people. Creativity and imagination also help us cope with challenging situations by giving us a different perspective and helping us find hope in difficult times. In CAMHS, we're increasingly seeing an increase in acuity and complexity, like I said, where many of our young people are not neatly fitting into therapeutic modalities, for example, CBT. So the need to be creative and think outside the box is becoming increasingly required. Secondly, we need to embrace curiosity. Another valuable lesson we learned from Alice is the importance of curiosity. Alice's insatiable curiosity leads her on a journey of self-discovery and growth. And as social workers, having curiosity can help our service users also go on this journey, can help us help others discover new passions and interests. It's obviously important to balance curiosity with a sense of responsibility and caution. While we're exploring new experiences, this can be exciting, but it's crucial to consider the potential risks and consequences. Again, this is an area in which social work in CAMHS excels. Thirdly, one of the most significant themes in Alice in Wonderland is the importance of embracing your true self. Alice struggles with the expectations and constraints placed on her by society as she navigates the strange and unpredictable world of Wonderland. She learns to embrace her unique qualities and strengths. As social workers, and I'm talking specifically about CAMHS social workers here, but it's probably equally as important in all fields of social work, it's essential to embrace and celebrate our unique qualities and strengths as social workers. By accepting ourselves in this role, I believe we can build confidence and self-esteem and find fulfillment in our role as social workers. It's also important to surround ourselves with people who accept and appreciate us for who we are and support us in that role. The power of perception. Can't quite see the whole picture here, but it's two people looking at a 6 or a 9, depending on where you're looking. Alice's perception of the world around her constantly shifts and changes, reflecting the unpredictable and nonsensical nature of Wonderland. Her ability to adapt to these changes and shift her perception of reality helps her navigate the challenges she faces. In CAMHS social work, we are also subject to constant shifts in our environment with regards to wider societal changes, government, other things like COVID, changes in the organisation, changes in staff. In addition to this, our young people's worlds change and shift very quickly. Young people are by nature very impulsive, can go from presenting as high risk to low risk, week by week or even day by day. This requires our staff to be adaptable and flexible, which is a particular skill of social work. Managing uncertainty and adapting quickly to situations. We are not wedded to one particular model or approach that makes this difficult. The value of others to support us. Alice forms meaningful connections with colourful characters, and these people provide her with support and guidance and companionship. It's crucial that we build up that connection and network amongst ourselves in order to support each other. And lastly, it's about facing our fears. Alice is confronted with a variety of frightening situations and learns to face these head on. And I think in our work day to day, we face frightening and anxiety producing situations with our young people. And it's about working through this discomfort and using our supervision, our support networks to overcome this and gain confidence. So my final message really is true belonging doesn't require you to change who you are. It requires you to be who you are. A quote by Brené Brown. And that's what I would like to say about social work in CAMHS. Let's go into social work and be social workers and bring the unique set of skills that we have into that service. And that's me done. Thank you very much.
Thank you so much for that, Annabel, and thank you to the rest of the panel. That was a really, really good session. And there's just so much that I'd like to sort of unpack there, but of course we're limited on time. What I would say to everybody is we've got the chat open now. Do feel free to complete the form that we've put in there, and put in any final perhaps reflections on the session just before we finish. And do remember, everybody, you can use this as part of your continuing professional development. And I think there's just so much there. But once again, I'd just like to say thank you again to our panel. It was a really, really good session. I didn't realise you could weave in Alice in Wonderland so well into social work, that you've done it. So that was great. Thank you.